Terrific. So you just had your surgery done today. I just want to go over some home care instructions with you just to make sure that everything heals well and then you recover the way that you're supposed to. So first things first, wound care. You've been given a pack of gauze. Just make sure that you're biting down firmly on it. When you do go to remove it, if it dries off, it can be a little tenuous in taking it off. I don't want you to rip away at the tissue that's still very, very sensitive. So sometimes just getting a little bit of moisture in there, a little bit of water can help make the removal of that gauze pack a little easier. But once it's out, what you do is get a fresh square of gauze, fold it once and twice, and put it back into that socket site, or surgery site, and bite down on it. The kind of pressure that you need, it's not a major clamping force, but just enough so that if you put a little pressure on it, you'll see tissue pledge. Okay. The goal is to make sure that the oozing and the bleeding and all of that stuff is coagulated. It can sometimes take up to a couple of hours, so don't be alarmed if you do see a little bit of an ooze from the site. Just mixture of blood into saliva can sometimes give it a more voluminous appearance. I mean, it's really not as bad as it seems at first. You just keep biting on that gauze there, and you should be fine. The most critical part is, if you're a smoker, don't smoke for the next 7 days or so. It's going to make things worse. The smoking will actually cause a higher degree of potential risk of developing something called a dry socket. So a dry socket is where there's bone exposure and becomes secondarily infected after the surgery. Very, very painful. If you do get into a situation like that, watch out for any bad taste, bad smell. Give us a call right away, and we want to get you back in again. Bleeding in the area is going to be normal. When you go to sleep, make sure that you change your pillowcase to one that is easily washed, because it's not unusual to see a little drop of blood or so on your pillowcase. So make sure that it's maybe an older pillowcase or one that you're okay with getting stained. Don't spit forcefully or suck through a straw, because that will create negative pressure in the mouth. If we have a tenuous blood clot in that region, sometimes it can kind of break free and start oozing once more. So just be careful with that, of course. If the bleeding does start once more, one of the neat tricks is to get a tea bag, and the tannic acids in the tea bag actually will help to increase the probability of a blood clot forming. That tea bag needs to be moistened, of course. It shouldn't be piping hot, so don't pour hot water over it before you use it. Just kind of get it soaked, get it moist, wring it out before you use it, and then gently and comfortably bite into it. Okay. Discomfort sometimes is normal after surgery. It can be controlled with medication that you were prescribed. If you did not get a medication or an analgesic that's strong enough for you, you can give me a call and give the office a call. Follow the prescription on the medication as directed. It's oftentimes not a good idea if you've been given a narcotic painkiller post-surgery, or if you've gone through a deep sedation. What we don't want you to do is mix the medications from the deep sedation and a narcotic painkiller. You're best off to avoid a narcotic painkiller if you're under a deep sedation, meaning that if you're put asleep for your surgery. So that means stick with your standard over-the-counter painkillers for the first 24 hours for 18 hours. 18 hours to 24 hours, and then you can start with the narcotic painkillers. Clearly, don't operate any heavy machinery or anything that will require your full attention, because that can be very distracting. Okay? Because of the nature of some of these medications, it causes a little bit of a disconnect between what your hands are doing and what your mind's thinking of. Diet-wise, drink lots of volume of water. Avoid alcohol, of course, but lots of water. Eat regular meals as soon as you can, as soon as you can after surgery. But immediately after surgery-wise, it's a good idea within the first 24 hours or so, stick with the liquid diet or a softer diet. Foods such as pudding, yogurt, ice cream, mashed potatoes, scrambled eggs. I'm a big fan of that. Pasta. If you're going to have pasta, make sure that it's overcooked and really soft. That's the most appropriate kind of food to have for the first couple of days or so. But as you're healing, try and get into a more regular diet the sooner that you can. The one thing that you'll find is that food will tend to migrate into and around the surgical site because of the nature of the socket that develops from a surgical site. So be careful about that one. depending on the kind of surgery that you had, you want to make sure that you follow the home care instructions for that particular site exactly. Some surgical sites will require that you just very gently spritz the area to clean it, and others you're allowed to swish around it, but more often than not, you don't want to have a big bullfrog rinse, otherwise it could dislodge any form of blood clots that form in that region. So rinse gently, rinse oftentimes, after meals. If you can get a hold of saline, or if you can't make one up yourself, it's usually a cup of warm water that's been boiled and then cooled, and use a teaspoon of salt into it. My favorite is either sea salt or iodized table salt, but preferably sea salt if you can get your hands on that. Again, don't rinse vigorously, because what we don't want to do is have a blood clot that dislodges and then causes any complications. Avoid using any alcohol-containing mouthwashes, because the alcohol does tend to dry off the tissue. It's indiscriminate in what it does in destroying bacteria. It also impedes healing, because the alcohol actually slows down the cells that are trying to repopulate that healing site once more. Usually within about less than a week, about 5 days or so, get back to trying to brush in that region again. In the interim, if you do brush away from the site, but just be very, very gentle when you approach that surgical site. Swelling is not unheard of course, in any sort of dental surgery. We do expect some degree of swelling. More often than not, it will reach its maximum in about 48 hours after the surgery itself. So if you're noticing some degree of increase in swelling, it should be gradual, but it can be controlled with ice packs. So get some ice packs on there right away. Sometimes frozen peas, frozen vegetables will work great for that site. So use ice packs in those regions. After about 48 hours to approximately 6 days, that's the time when most of the swelling will start to kind of crest and start to get back to normal again. So just keep an eye out for that. If you do use ice packs, the important thing to remember is that we don't want to overdo it. Okay, so half an hour on, let the site kind of recover, and then half an hour back on, off again, and then half an hour back on again. So you want to keep the ice packs going. What the ice packs do is it vasoconstricts the blood vessels around the surgical site, and it just helps to reduce the amount of interstitial fluid that can add to that swelling. If you do have swelling that kind of increases very, very dramatically, give the office a call right away. I want to make sure that there's no complications involved. Do get lots of rest within the first 24 hours. Don't go running a marathon. Don't do jumping jacks, handstands. What you want to do is avoid increasing your blood pressures, so that it will cause a spontaneous increase in bleed from that side again. So take things easy if you can. Sit back, relax, catch a movie. That's always a good idea. Bruising can happen sometimes. It's a normal reaction. Don't be alarmed, because the bruising oftentimes will appear just in, around, and fairly close to the surgical site. You want to just keep things fairly comfortable in that region. Bruising will appear, but it will oftentimes go away on its own within about a week to 2 weeks. Now, stiffness after surgery is not unusual. There may be some limited opening because of the nature of how the surgery had gone and how the muscles and soft tissue heals. The stiffness is normal, and again, it will resolve itself usually within 5 to 10 days. In most cases, you will have had some stitches placed. Depending on the kind of stitches that are used, oftentimes they are resorbable and they will come out on their own. If you've been advised to come back again for suture removal, please don't ignore that advice. Make sure that you keep to that appointment. We're going to see you back in again and have those sutures removed. Again, most of the time, the sutures that are used will come out usually within about 24 hours and at most about 7 days. If you have any emergency questions or concerns, refer to your home care instruction sheet. All the contact information is right on there. Happy healing. We'll see you real soon.